Solano College TV studio. I'm joined by Alexa and Joanna. We'll be discussing medical malpractice as our podcast topic. We'll be talking about what causes medical malpractice, the consequences of medical malpractice, and what can we do to prevent it. And Joanna, my first question is what factors can lead into medical malpractice?
A lot of it comes down to the people being involved. People can feel burnt out, under pressure, and sometimes not enough training.
I think for some external facts is some hospitals are overworked, making nurses rush a lot and making mistakes and not double checking stuff. Some hospitals don't have a lot of staff, which makes working too much, being rushed, a problem. And sometimes it could be mistakes by doctors, and not a lot of communications between doctors and nurses. I think that happens a lot. And sometimes even with patients, like the patient probably like saying the wrong symptoms that they're feeling, and the nurse is just writing whatever the patient says. I think that's a big factor too.
So I do agree with the burnout and stress. A lot of, it's pretty a known fact that there is a nursing shortage right now.
Yeah.
Even with those nurses, they do majority of the nurses do feel burnt out for their work. A couple other things I want to include is just miscommunication. Just not asking proper questions to the patient, or even during shift handoff, you're not getting the correct information from the charge nurse.
Yeah.
Another thing I want to add is lack of knowledge. So if you're just you don't know what to do with the patient, it can lead to errors in patient care. As you said, lack of staffing, very, very common. I also want to include financial gain. This applies mainly in the clinical setting or outpatient care, but doctors have to see more patients with less time. So there's you go to the doctor's office, right? That's the main reason why doctors are running so behind, because they don't believe it's not enough time for them for a one-on-one with the patient.
Adding on to that, since there's a lot of new nurses, a lot of nurses don't like to train the new nurses. I don't know, they just think that the new nurses know it all, but they just graduated from nursing school, so they don't have the experience for that. So I think just nurses need to be more patient with other new nurses and show them the right way to do it, because they've never experienced it. It's the first time. So I think that's another big factor.
And adding on to the doctors, seeing so much people, that can be super overwhelming.
Yeah.
Very overwhelming for the providers, everyone on the medical staff, because for example, in primary care, you don't know what the patient's going to be going in for. The visit could take 20, 30 minutes. I have a personal experience with that. So it's a very, very, very broken system, I would say.
It is,
which
sure.
I do believe is we do need to fix it, but maybe in our lifetime, maybe later on, it'll be fixed. But now our next segment. Now we understand what factors can lead to medical malpractice. Do you guys think the consequences are severe enough for new cases to start?
Well, malpractice cases keep rising, partly because most cases never really get reported. From what I researched, only 1% to 2% of victims ever file a formal claim. And consequences alone aren't stopping repeat offenders.
In my opinion, I think that some consequences are enough for some people, because some people just make mistakes, or some people don't know that they made a mistake. But I think for people, some people that, I don't know, some people don't have enough consequence, and some people do get enough consequence.
It's inconsistent.
That is true. Some consequences I know is being sued for millions of dollars. Some are losing their job, or losing their license. And some people just don't get nothing at all. They don't even get their license revoked, or they don't lose their job. But I think that it's because sometimes it's not their fault. It's like probably the doctor's fault or like the hospital's fault. I think they don't get enough consequence because in this article that I saw, it said that the third leading cases of death is from malpractice. So I just don't think it's giving enough consequence for it to not keep happening. And I think it's just even as something as simple as giving the wrong medication or writing the wrong symptoms can cause that, and not a lot of people get the consequence that they need.
I definitely agree. But I would say, in my perspective, I won't say that. I would say the consequences are severe enough for providers or nurses, because it is scary losing your license or even losing your job.
Yeah.
But I think it's more of a systemic problem
It is.
for professionals, rather than like them just intentionally harming patients, because
Yeah.
they're taught not to intentionally harm patients that way.
Yeah.
I did see from a case or an article that I read, it says that even if a medical malpractice case starts, it's typically settled in court 96.9% of the time. As I also want to add on to the license problem. Rarely, medical providers don't get their license revoked.
Yeah.
I think it's just typically because I do know if there's a malpractice case, it goes through the state board, and there's just not enough people to investigate any wrongdoing, so the doctors just typically keep their license.
Okay.
I think only in very severe cases where like the patient has a permanent injury or there's death involved,
Yeah.
then yes, they'll probably there's higher priority to investigate the case.
Yeah.
Yeah, and adding on to that, the case that I was researching, the clinic never caught on to the mistake. It was actually the family who found out, like, through DNA sampling 14 years later for IVF case that I was working on.
IVF.
Yeah.
Also, the family discovered it. So
Yeah, the family discovered it 14 years later that it was not their baby.
Oh my.
Yeah. And that's so sad to hear.
Yeah.
To find out that a baby that you guys were trying to work on for so long, trying to procreate, just to not be your baby.
Yeah, that's sad.
what happened to what ended up happening? Did the family sued the clinic?
The family ended up suing, and they earned $2.1 million.
What happened to the
clinic.
like the professionals, like the medical providers?
I actually didn't get through all of that, but I'm not sure if they lost their license, but they should, because that's a lot. Like the sampling, it got mixed up, so that's not.
So they definitely weren't following protocol or
They
something.
weren't,
They
Yeah.
weren't. Okay, our next segment. So we learned about the consequences of medical malpractice. How do you guys think we can prevent new cases from happening?
I think one of the most practical solutions are simulation training, giving healthcare professionals a safe place to practice high-risk procedures before doing them on real patients. And I feel like this is especially important for the case that I just brought up, the IVF case. And because it's a very delicate process, the procedure. Like a single sperm into a single egg using a thin needle. It's a delicate process.
Yeah.
And even like small errors can reverse everything.
Yeah.
How about you?
I think to prevent some of these stuff, I think if you're overworked, I say taking mental health, breaks. I think that's a very important thing because everyone needs them once in a while. I think double checking everything, of course, communicating with doctors, nurses, or if you're switching from day shift and then the night shift nurse had the patient, I think you should communicate with that person and double check everything. and check with the patient, of course, just to triple check. I say make sure that you have the right patient, like the right name, right last name, and double checking the date of birth, their symptoms, like stuff like that, just so you don't have the wrong patient and give the wrong stuff to the patient. Say staying updated with everyone around you, the environment, like your nurse, your doctors, people who already had the patient, like other nurses, accurate the documentation, and I say teamwork. Like, I think teamwork is a very important one because you need to have communication and you need to trust your, your coworkers. But I say double checking is the most important thing. Even if you're overworked, I know some people are tired and they can't do anything about it.
You can't really think. Sometimes like they're working on.
Or they double check and they just think it's right, but they're not because they're overworked. So I think mental health days is the most important one.
I really agree. I really do believe in proper documentation, as you said. There is a saying within healthcare that if you didn't document, it did not happen. You could remember everything that happened that day, but if you didn't write it down, then
that is true.
It never happened. Like for a law or even to your coworkers. So documentation is very important. And I just had a recent case at work that a patient or my coworkers were telling that a patient had a vaccine. I think it was the flu vaccine. They were complaining of pain on their left arm, but because my coworker documented that, he actually had the injection on the right arm.
What?
So even though the patient had the injection on the right arm, but was complaining of left arm pain, so it could not be from the vaccine at all. So that's why after sharing that a couple of days ago, it kind of really reminded me, like, hey, like everything I write down is
important.
Another thing I want to add is add on to clear communication. I would say use really like simple terms while you're explaining to the patient. Don't use like medical words. You don't want to confuse the patient even more. In my case, I always explain what I'm doing in front of the patient, so they're kind of involved in the process. And adding on to double checking on patient information, always double check on allergies. That's very important. If something happens and the allergy's not on file, then it's not really on you because they just develop an allergic reaction, but there was no allergies on file. I also add on to a better workplace culture or better work environment. I feel like it's really important that you have coworkers that support you, that are able to help you when needed. I'm very fortunate enough to have coworkers that, if I get stuck on a patient, they can room the next patient for me. They can do an injection for me because sometimes clinic can get very, very busy. So it's really, really nice to have supportive colleagues or coworkers. Another thing I want to add is patient autonomy. If a patient declines on something, you want to respect their choice. They declined getting a vaccine today, document, hey, like they declined the vaccine today, but also like you don't have to force that on them.
And also adding on to your coworkers, I think it's very important to also have each other's back, because like you said, they bring your patients in while you're doing another patient because it gets hectic. I think that's a good teamwork, basically. I think it follows with the teamwork title. So I think that's a very good thing.
And adding on to the mental break for like the doctors and the nurses. Trigger warning, I heard that the suicide rates for physicians are really high.
Do you know the percentage?
I think the percentage, I'm trying to guess. I'm not trying to guess, but I did see somewhere like 53% of suicide for physicians, and I think mainly because they're overworked.
Yeah.
I think, yeah, it's because there's patient volume, but also there's like after like you have to document after hours.
Mm-hmm.
Yeah.
So like they're spending like past their shift, like they're spending like 2 to 3
Yeah.
hours just documenting on the patients,
Yeah.
and like and sometimes if they're overworked, they could miss a very important dosage while documenting. So it is very very unfortunate that is a problem.
Yeah.
So I'm pretty glad that we take mental health a lot seriously now,
Yeah.
because I know the previous decades like it wasn't as an
Mhm.
issue, but
Yeah.
now a lot of doctors are taking breaks as needed.
Yeah.
Even
Yeah.
medical staff like nurses, medical assistants, LVNs, they take breaks as needed. I don't mind if they take a break because I always pick up shifts, so
Yeah.
it's a win-win for me. But yeah. Another thing I want to add is patient privacy.
Mm.
So you don't want to openly discuss like patient cases
Yeah.
in front of like everyone.
Yeah. Probably violating HIPAA.
Yes.
Yeah.
Yeah, I think it's super important to have a good environment in the hospital. Like
Yeah.
wherever you work at, be cool with everyone. Because in places like that, you have to be so careful. Like
Yeah.
in the hospital,
Mhm.
it has to be like double check everything. And it's sad seeing that people
Make
not get
mistakes.
along and not
Mhm.
get along too.
Yeah.
Yeah.
I think it's just the added stress in the environment because healthcare is
Yeah.
already
True.
stressful.
Like everyone's emotions are super heightened.
Mhm.
Yeah. And I think patients sometimes they come. I know they come because they're feeling symptoms, and sometimes they're like anxious or like they're just like scared. So I feel like they give like a hard time to nurses or doctors.
Yeah.
I know not all the time, but some patients are like that. And I think some people just need to have empathy for the workers because they do go through a lot. Like sometimes they can't even take a break because they're just understaffed, or I don't know. Some people are just
People have their own problems.
I think
Yeah,
empathy
home
is a
too.
two-way street. Is a two-way street. Like, healthcare workers always provide a lot of empathy, but sometimes patients don't reflect it back way.
yeah,
so
that is true.
it's very unfortunate.
Yeah. It could probably be because, of course, they're sick. They don't know what to do, and like they just don't feel empathy at the time because
Yeah, in the moment, like it's
Yeah.
kind of hard for them to like be empathetic when you're
Yeah.
like in pain.
Yeah, so they make it
Yeah.
harder for nurses or doctors.
Because you never know when a doctor's having a bad day and the
Yeah.
patient's coming in like, oh, you never prescribed me this, you never let me.
Yeah, like
never
having a
helped
bad
me."
attitude.
Yeah. So of course doctors are burnt out from seeing patients like at every hour, not even every hour, maybe like every.
Like every 20, it's
Every
like every 20 minutes.
Oh.
Yeah.
That's-
So I get why doctors can make mistakes.
Yeah, and plus if they have kids at home, I think it would be more pressure on them, and personal problems, family
Yeah.
problems. There's just a lot going on with people.
Yeah, if you have like a lot of personal problems going on, then it's very hard for you to separate it from work.
Yeah.
Like if like a family member passed or like someone got really seriously injured, like it's very hard to get that off your mind while working.
Yeah.
It could affect how you can treat patients.
Yeah, that
Yeah.
is true.
I also want to, I just remember documentation. So for when you're documenting for patients, I always told to I guess this is like a little one since you guys are going to become nurses soon.
Yeah.
When you're documenting, you always want to try to document in third person. Never want to use like I while documenting.
Okay.
And always document the time, especially the time. Any patient refusals. Just if the patient's like even giving you attitude.
So just anything, like
Literally
everything.
anything.
Yeah,
That's
basically.
crazy.
Because I mean, well, yeah, if something happens, it's you have everything there, so it's just showing proof. If you do
Yeah.
go to court,
Mm.
so
Like even in my work, when a patient walks up and they're requesting something, I still document it.
that's
that's
good.
good.
Yeah.
Even like appointments, like I still document what their appointment's for and
Yeah. Yeah.
the day and time. So documentation is just very important. It's if I were to like tell like future people working who are going to go into medicine or like work in healthcare, like documentation is just a very, very important thing to do.
Yeah, it's mandatory.
Mandatory. It's mandatory. I thought.
Yeah.
But that is it. I hope you guys enjoyed our podcast on medical malpractice. I'm Carlos, joined by Alexa and Joanna. Always remember, if you didn't document, it didn't happen. Thank you for listening.